Geospatial intelligence and AI are revolutionizing how we predict and respond to health crises. Our next guest, Ajay Gupta, brings nearly 3 decades of cybersecurity and IT expertise to healthcare transformation as co-founder and CEO of HSR.Health. After identifying critical gaps in healthcare analytics, Ajay built an innovative geospatial platform that predicts health risks based on social and environmental determinants of health. From supporting WHO's COVID-19 response across multiple continents to helping communities prepare for natural disasters before they strike, HSR.Health's technology enables organizations to anticipate disruptions to operations, assets, and populations they serve. Join us as Ajay shares how his team combines cutting-edge technology with healthcare expertise to create a more resilient global health system and drive meaningful impact where technology meets public health. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, Ajay. A big welcome to our podcast. I'm so excited to have you here today.
It's a pleasure for me as well, Mike. I'm really happy to be here on this show. I've listened to a lot of episodes. I didn't really ever think that I'd be one of your guests, but here I am. It's great.
Well, here we are today. But, given your near 30-year career in cybersecurity and information technology and how you've leveraged that expertise to transform healthcare through HSR.Health's innovative geospatial platform, I'm excited to have this important conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast. You will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli in Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and X in order to further the conversations occurring on this podcast. All right, Ajay, it's almost time for our community to learn how you and the HSR.Health team are pioneering healthcare transformation through geospatial data and AI, predicting health risks based on social and environmental determinants of health. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
One piece of advice I give, whether you are in healthcare or anything, is to stay courageous and imaginative. I think those are 2 really key skills we need to accomplish anything. Keep courageous. Don't be afraid of failure. Don't be afraid of listening and hearing what other people say. Just do what you think is right and be imaginative, right? If you want to solve a problem, you probably can't do all of the things that happened while the problem was being creative. Be imaginative and do something different, which is really where modern technology, I think, thrives, right? Because modern technology, whether it's geospatial analytics or it's artificial intelligence or remote monitoring, satellite data, we really have the opportunity to do things completely differently than they were done before. And all that takes is a little bit of imagination, coming up with new solutions. That's my advice to everybody. Courage and imagination.
Let's stay there for a moment. I absolutely love the courageous part as well. It can be daunting to create something brand new out of nothing. And everybody around you and all the signals are saying, don't do it. And it can't be done until it's done, right? I got to imagine we'll be diving in on the other side of the commercial break, but you've been at it now for over 12 years with HSR.Health. That is a feat in and of itself. I got to imagine, when you first took those steps and founding the company, there was a lot of courageous times that you had to look back and say, hey, maybe there are the signals there are saying, don't do this, but here you are, you defy the odds. How big is that mindset of being courageous and leading with that kind of courageous heart and intent? How important has that been in building the company?
You do need that because there's always going to be signals that say not to do whatever it is you're doing. Whatever it is you're doing, there's something easier, safer as an option, right? So the signals from the marketplace, the signals from the world will always point in that easier, safer direction. So you do need that courage, and not just the beginning, you need it every day throughout an experience. I mean, honestly, you said 12 years, right? I had to think about it, right? Has it really been 12 years? It doesn't feel like that. It feels like 12 days sometimes, but it does take courage to stay on path and continue to do what you feel you're doing. And as long as you can pair it with, imagination, and pair it with being intelligent about it. I mean, just don't go out and fight a lion, right? Don't be courageous enough to do that. But it does take a lot of this kind of courage and internal fortitude to stay on a innovation pathways for a long period of time. There is no doubt about that.
Well, thank you for that, Ajay. We're going to talk about it. As you mentioned, feels like 12 days sometimes. You've been at it now for over a decade. We're going to discuss how it all came to be, what you guys are working on today, and then, of course, what maybe the next 12 years plus might look like. We're going to discuss all of that and more after we get back from thanking our community champion sponsor. Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you, who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow. All right, we are back with Ajay Gupta, co-founder and CEO at HSR.Health. Absolute awesome introduction. Having that courageous and kind of unbridled creativity, I think, is so important today in innovation and building new technologies and new companies. Ajay, you really set the stage for us on the front end, so thank you for that. But of course, we have a lot to cover today on the episode. Again, as we mentioned on the front end, 12 plus years now at it with your organization doing exceptional things. We're going to discuss how that all came to be in the first place. And then we're going to discuss what's happening today. How are things with the organization? Where are you guys at today? What are the big problems that you and the team are solving? And of course, where do you see things heading as well, right? We know things are moving very fast in this space. Would love your insights of what we should be mindful of as a group here tuning into the podcast, of where you see things heading on the macro. And then, of course, for the organization as well. Then we can't let you out of here until we get an opportunity to help you and the team out. So we'll be asking you one of those questions of how we can be offering up with this amazing community rallied around the podcast, offering up opportunity to help you and the team. But of course, before we get to all of that, Ajay, take us back. It has been over 10 years, but give us, those early machinations, those early aha moments. How did this organization all come to be? What were the whys? What were those breakthroughs that really said, okay, I have to launch HSR.Health? Take us back a bit. Take us behind the scenes of how it all came to be.
So there really were two things that happened right around the same time that got me and my co-founder, convinced us to start this business. One was that a professional colleague of mine still has a medical practice where she treats patients for specific conditions. And obviously I'm being vague because I don't want to give it away. It's HIPAA and, her practice and everything. But she noticed that one socio-demographic group outperformed all others in care outcomes, right? And, while there is a discrepancy or a distribution of outcomes across populations, it's not supposed to be that one socioeconomic group, socio-demographic group outperforms everybody else. So she mentioned that to me at that time, was just a colleague of mine. We hadn't started the business yet, that this is what she's seeing, and said that it's not right. There's something missing, right? So we will help you figure it out, right? So we looked into it and we did your basic data analysis on her patients, on her program, on her treatments, on what was happening. We figured it out, right? We figured out that there is something different in how those patients were being treated that was leading to a better outcome. Something that once she identified it as the treating physician, once she knew what it was, she could modify that for everybody else. And now she began to see outcomes rise for everyone. I mean, one still outperformed, but then it was more of a normal distribution of outcomes across the entire patient population, which is better. It's the same exact time. If you recall, in President Obama's first inaugural address, he said, we're going to wield technology's wonders to advance healthcare's quality and lower its costs. So at that time, there was a lot of conversation about how to change healthcare. Obama came in, we're going to revolutionize healthcare. And there was unanimity on the fact that technology hadn't really helped healthcare very much. There was very little everybody agreed upon about healthcare. Maybe they still don't agree on a lot of things, but there is agreement that technology hasn't done a lot to improve the state of U.S. healthcare system. So here we were, inspired on one side to say, hey, there's got to be ways that technology can do better. And then just had come off sort of this personal success where we saw where applying data analytics actually did lead to better outcomes for patients in the real world. We said, well, maybe we can use technology to do something that does that at scale, and we can help healthcare nationally and globally. And so then we started HSR.health. How can we use tech to improve the ability to analyze problems within healthcare and lead to helping organizations, health systems, departments of health, community service organizations, maybe even practicing physicians, do things just a little bit better and improve health outcomes? That's where we got started. And, as you said a few times, we are still here.
Yeah, which is a feat in and of itself, as you know. But let's go back to those early days, Ajay. Let's stay focused on that for just a moment. Obviously, you had that N of one with your co-founder and having those kind of conversations like, oh my gosh, there may be a there. You know as well as I do, as any founder or any tech entrepreneur, it's obviously important to get out in the field, get out of your office, go get that feedback beyond your co-founder. What was that early feedback like? What were you hearing out there when you were kind of pitching this idea or sharing what kind of things that you and your co-founder were seeing?
So as I said, there was agreement, and there may still be agreement, that there isn't or there aren't a lot of technology-based solutions that are actually helping in healthcare. Even today, I'd say that the AI technologies that are proposed to advance healthcare, once they're implemented, whether fully implemented or even in pilots, they don't really seem to move the needle and improve outcomes, right? They cause sometimes more problems than solutions at the bedside or in real world. So there was a lot of agreement that we were hearing that, yeah, we do need better technology. Yes, we do need better data analytics. Healthcare just doesn't do data analytics, right? Physicians treat the patients they see in front of them. They know from their memory, their history of treating patients over the course of their career. But truly analyzing the state of the broad patient population is simply not something that is, or at least certainly not back then, it just was not really done. So there was a gap that we had identified that we could do, and a place where we could sort of stake a claim that we can help understand the causative factors behind patient conditions that clinicians can then use to better treat their patients, and that departments of health and communities can use to maybe potentially improve conditions community-wide that might help reduce the stresses that their patients, that their fellow neighbors live under.
And so we're taking it today. Obviously, it's a heck of a journey. And you know as well as I do, it is not a straight line. Matter of fact, it can be very circuitous at times when building a startup. From those early machinations of the organization to where we are today, how about let's shine a light on where is the organization today? If you had to sum it up, we're in an elevator. We only have about a minute together. What would you share with me today on who HSR.health is?
We allow organizations of all kinds to anticipate the potential disruptions that health risks may cause their operations, their assets, or the populations they serve. We give you that information up front or in advance so that you can take actions to mitigate those problems. That's the elevator pitch.
And I appreciate that. And I know one of the big areas that is part of the organization is the GeoMD platform, and that helps to predict those health risks. Can you share any specific examples where this technology made a measurable difference during, say, the COVID-19 response? Obviously, that was something that we all dealt with personally, professionally, or otherwise. Is there anything to shine a light there?
Yeah, so we did a lot during COVID. The World Health Organization used our models for tracking the transmission and mortality risk for COVID in 2 of their 6 global regions throughout Central America, through CARICOM and PAHO, as well as throughout Africa, through the WHO's Afro office. We essentially helped identify what the transmission risk of COVID-19 was for those communities and populations. And we worked with not just the WHO, but throughout the United States as well. But we work with organizations and states to identify things like where should they send resources for COVID, where should vaccines be deployed, in what order, so that we get to the highest risk patients first, You remember when the vaccine was first released, it was limited supply, right? So we had to be, for a significant period of time, there was a great urgency and need to be strategic about who's getting the first doses of the vaccine. We want to give it to those who need it the most, who will benefit the most. And then, of course, eventually supply ramped up and anybody could sign up and get a vaccine. But initially, we wanted to be strategic. And our ability to identify who's at greatest risk, and by reducing the risk for those who are greatest risk, how much net benefit is there to society as a whole? Our solution does that. That's something that you can do right with the GeoMD platform. And we've done that even before COVID. We were using the platform to identify causative factors to adverse health outcomes in a way that allowed organizations to take actions, right, to reduce those outcomes. We've been doing that here in the United States and globally. In fact, one of the examples was actually in the Middle East, where we showed social factors, believe it or not, the school start times correlated to outdoor external building construction time that led to pediatric respiratory challenges that requiring admissions for young people. As you know, right, the more time young people spend sick or in hospitals, the larger probability that they'll have lifelong health issues. But the healthier you can keep kids while they're young, the greater probability that they'll be healthy their whole lives. So one thing we noticed working in the Middle East was that when children who are already exposed to a heightened level of dust in the air, because it is in the Middle East, when they were going to schools and around the same time that external construction was going off, meaning that there's a higher particulate matter in the air, they were exposed to more poor air quality. That caused increased respiratory challenges. By just simply shifting school start times or construction times, you could avoid those. Then you saw less pediatric respiratory issues causing children to have to be hospitalized. And then that we actually were able to replicate in America and in certain areas as well, that kind of analysis.
Let's stay on that for a little bit. That is fascinating, but let's stay on that topic a little bit more. We'll pull those threads just a bit more. And of course, you just shared a very surprising correlation there, but let's maybe double down on it. Ajay, how does HSR.Health incorporate social and environmental determinants of health into its risk models, kind of what you just described? And beyond what you just mentioned on some of those examples, what are some other examples that have been most surprising in regards to the correlations that you've discovered?
Your first question about using social data, our definition of social determinants, social environmental determinants of health is maybe a little different, right? We define those as how we define the world we live in. Many people will tell you that official statistics are, the American Hospital Association has stated that something like 80% of health outcomes are due to social factors versus in-hospital clinical care, right? What I take that to mean is, this might come as a shock, Mike, but we are a part of Mother Nature. We are just another part of the world we live in. And because we're a part of the world we live in, if we can adequately define the world we live in, that should incorporate a lot of things about what's going to happen in the future, including our general health outcomes at the population level. Just using that little bit of nuance to the concepts that we all know, social factors, Mother Nature, we live in the world, it's all one world. If we analyze those factors, that data, and we've developed some very interesting and innovative algorithms, I will say, we should be able to interpret and to predict what health outcomes are coming in the future. And at the population level, we've seen that over and again to be quite accurate. As a high-level, broad example, in January 2022, we were able to run a prediction model of COVID case counts as if it was January 2021 for a full year. So obviously, when you do that in 22, we do know the data. So we know the outcomes. We have something to compare against. And we were able to say that our prediction of COVID case counts for a year did match quite well the actual case counts for the course of the year. Almost so that if I graph it and you see the graph, it'll look like one line, not two. We're pretty confident in our abilities, and it's all from this notion that social factors influence the world we live in, and the world we live in influences our health.
And let's change gears a touch, even though what you just mentioned really did impact in many different ways and factors our healthcare systems here in the United States. As you know, we have a lot of folks, a lot of executives and thought leaders and decision makers on the healthcare system side of the aisle tuning in to the podcast. So let's go there for a moment. How is HSR.Health working with healthcare systems to translate those risk predictions into actionable interventions that are improving outcomes and reducing costs, which, as you know as well as I do, is so important in today's kind of environment.
So there's a number of ways, right? I'll give you sort of the top 3 ways that we feel our analytics are best suited to aid in health outcomes or improving health outcomes. One, and hospital systems do this now, as do insurance companies as well. Risk stratify patients for particular outcomes, right? Whether that is stratify patients for who is at the greatest risk of readmission or who's at the greatest risk of a particular disease taking place, right, for that patient. We have novel ways that hospital systems or insurance companies and others can use, not necessarily to replace what they're currently doing, although they could, but additive to what they're currently doing. A lot of those risk stratifications are based on other things like clinical data, maybe family history, maybe some genetics, although that's itself in its infancy. But they're not truly looking at what the social conditions are in and around the patient and their life, right? So we can do that. Our ability to help risk stratify is additive to current measures and will only make those current measures more impactful and more precise. I think that's a very powerful way that we can help health systems. But you were asking how we can help. We can help risk stratify patients. We can also assess where are the risks of disease outbreaks and conditions going to be. As an example, we know that there are a number of diseases that we call them vector-borne disease, where you really get them if you get bit by an insect, right? And if those insects aren't living near you, you're probably not going to get those diseases. But we see that because of environmental change, because of human mobility, and because the insects themselves are adapting too, that the range of those diseases, dengue, malaria, is spreading. So now we do see cases of vector-borne disease taking place where they hadn't been even just 5 and 7 years ago. We can predict where those diseases are going so that health systems and communities can be aware and take preventative measures. Maybe all you need is some health education to let people know that this is now a risk. It wasn't a risk before. So now protect yourself against vector-borne disease or in mosquito bites or insect bites. Or some communities may want to do some kind of spraying or some other kind of measures to combat those insects to keep the risk down, right? That's an area that we worked in. And sadly, we think that's going to be a growth area as these diseases spread throughout the world as the climate is, the environment we live in is changing. And the third area is in the disaster response area. Several years ago, we had a conversation with colleagues of ours on the Public Health Service and FEMA as well, who told us that they don't know the health and medical needs of a disaster-impacted population until they get on site, which is days after the disaster strikes, right? They come on site after the disaster and then, do what needs to be done. But in healthcare, that's a delay. And any delay costs lives and worsens conditions. So we told them that we have a predictive system. We can tell you some visibility into the health and medical needs of that population before the disaster strikes, before the hurricane makes landfall, for instance. And so with that information, as you watch the news, unfortunately, there are disasters in more and more places nowadays. So we can inform communities of what the likely health and medical needs will be in the disasters to which they are most prone so that they can be ready to take action. This can help improve the resilience of all of our communities. And they can have a source of information that they can use in the immediate aftermath to do things like know where is the best location for water and food distribution, where's the best location for an emergency field hospital, and those kinds of things. And then in the long term, whatever healthcare infrastructure was damaged will need to be replaced, and that replacement infrastructure will need to be aligned with the new population that lives in that area post-disaster. After disaster, maybe everybody comes back to where they were living. But Mike, that doesn't always happen, right? Some people no longer want to live in an area that's prone to a fire, or they have no real place to go back to, so they, move on with their lives. So the post-disaster population density and distribution is often different, and therefore the healthcare infrastructure can be different. And actually, in some communities, if you are always looking for a silver lining, a disaster can be an opportunity to better size your healthcare infrastructure to the needs of your population.
Excellent. Well, let's pull the crystal ball off the shelf for a bit as well, Ajay. Let's talk a little future state here in regards to, looking forward over the next few years. What emerging technologies or approaches that you believe will be the most transformative in helping us anticipate and address health crises before they escalate? And where is HSR.health going to be in the middle of all of that?
Well, I hope we'll be at the bleeding edge of all of that, right? With the tip of the spear. What we are seeing today is truly an expanse and advancement of the ability to predict future outcomes, and not just outcomes, but even events, right? That is a very exciting time in healthcare. And we say this based on the technologies we have today, right? We have really the infancy of generative AI and artificial intelligence with some machine learning algorithms, some of which have been in training for decades, but not yet fully broadly deployed, right? So all of those technologies should improve. We're at the very beginning of using geospatial analytics and visualization for health outcomes. We're at the beginning of using satellite data. We're data from satellites in outer space that look back on Earth, take pictures, and we can extract features from that data that impact health outcomes. All of that is at the beginning. And we have not even begun to imagine how quantum computing will further enhance all of these things, right? So I think anybody who's in technology has to be excited about the future. We have to be excited about the future. I haven't mentioned that we will integrate wearables into the practice of healthcare. Before, you would get a test of some measure of for yourself on a regular basis that might be months. Blood sugar, most often, right? And diabetics would prick their finger on a scheduled basis with months. Now there are systems that can do it in real time, 24/7. So the ability to track and respond to patient conditions is going to go up in the future. I don't think that we're ready to really care for a diabetic or pre-diabetic patient on a 24/7 basis, because we're really just learning what does that really mean in terms of moment-to-moment insulin levels, right, and insulin resistance for patients. But that will come in the future. So the ability to manage chronic conditions should improve dramatically. All of that is coming, and our role as a data analytics firm that understands the need from the healthcare perspective, I think we have an opportunity to provide a platform where all of this can happen. We have a platform that can run complex analytics, machine learning algorithms, et cetera, that can be used by health systems and by individuals and communities to be a place where we were correlating broad sets of data, social data, environmental data, patient data, any kind of data to provide up-to-the-minute, point-of-care clinician decision support.
A very exciting future indeed, and feels sometimes the future is now with things moving so fast. Ajay, let's bring it back to current state. Of course, we definitely want to ask how we can be helping you before we do sign off. What's one problem, need, or question that you and the HSR.health team have that we can be helping you with?
I wish I had a creative ask, but we just need money. That's it now. We are thinking, even though we've been around for quite some time and have not raised external capital, I do think that now is a very good time to do so. We're truly out of the pandemic now. The pandemic officially ended or was declared over in March and May of 2023 when the WHO and then the United States declared the end of the pandemic. But then, to cycle all of that work out of public health institutions around the world took about a year, a little bit more than a year and a half. And so now we're truly past that. And we're now at a nice stage where we think that given that we are a geospatial AI firm in public health and health risk analytics, that this is a good time to take our technologies, which has some bit of novelty, right? We've got a generative AI orchestration engine that curates data from authoritative sources around the world, runs broad spectrum analytics, and can provide guidance back to users in natural language, that we have something unique to share, unique to offer. So we're taking these solutions out to the market to raise funds so that we can grow at a fast pace now, a faster pace than we've grown in the past. That is the challenge of the day for us.
Well, with that challenge and those needs to continue to scale, how does our community get a hold of you, contact points online, social media handles, or otherwise? How do they reach out to have those conversations with you, Ajay?
Well, I am on LinkedIn, which is always a great way to connect. Our company does have a presence on X as well. We have a YouTube channel where we've got a lot of our demos. We've actually increased the number of demos, videos about our work and our past successes that I'd love for your audience to browse through. And then my email address is impact@hsr.health.
Easy enough. And for our listening community, simply scroll on down into the episode notes in your favorite podcast player where you're accessing this episode. There will be all those contact points for AJ and the HSR.health team, or you could head over to our free global online community at passionatepioneers.com. There will be a post for Ajay's episode where you can find all those contact points online and be able to leave any comments, feedback, or otherwise, again, over at passionatepioneers.com. Well, my friend, we are almost done with one heck of a conversation. I've been waiting and waiting for this one. I'm so glad we were able to finally sync up and have it. But before we let you go to get back and continue to cause all that really good trouble that you and the team are helping lead, we have one more piece for you. It's a fill in the blank. I'm a passionate pioneer because...
Thanks, Mike. It's been a lot of fun to be here, and I always love talking about what we do. But I'm a passionate pioneer because I see today's groundbreaking technologies like geospatial intelligence and Gen AI as unlocking unprecedented opportunities to predict, prevent, and solve global health challenges. Deploying these innovations, we are not just adapting to a future. We're actually building a healthier, more resilient world, and one potentially beyond what we've ever imagined. I mean, if you think about it, right, the ability to manage chronic disease on an ongoing basis versus whenever you choose to go see the doctor, that could dramatically improve the quality of life for everyone with a sensitive chronic disease. That is something, worth getting out of bed for every day, every morning.
Well, thank you so much for coming and being part of our community and sharing all the wonderful things happening in the HSR.health camp. We appreciate your time and look forward to continuing to follow the journey on what is next and what is possible with all of the things in front of you and the team. But for now, we're so grateful that you were able to take some time and spend it with our community. Of course, we look forward to continuing to hear all of the wonderful advances. But again, thank you so much for being with us today.
Thank you, Mike. It was great to be here.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.